few weeks ago, you may have heard us mention something called compassion fatigue. Now, this is something that we've had a lot of questions about. I have had a lot of patients that have mentioned that they think they may have this or are experiencing this. So we brought in Dr. Ness once again, our specialist, our psychological specialist, that's going to explain to us exactly what this whole compassion fatigue is, and maybe if you can relate to it and what you can do about it. So, Dr. Ness, why don't you tell us? So this compassion fatigue, the way I said it, definitely hit a string with a lot of moms and women.
Sure.
What exactly is this?
Sure. Just by definition, compassion fatigue is really it's secondary stress. And it's typically first responders, it's military folks, therapists, counselors, social workers, parents, mothers can certainly fall within this category. But it's those individuals who are treating people who are experiencing trauma themselves. And so typically it's an accumulative effect where the ongoing experience in working with individuals that have their own trauma, it has an effect on themselves. Absolutely. And what happens is if this is not attended to or recognized or there's a lack of awareness that this is affecting you, it can certainly have effects in other aspects of your life and how you function.
Wonderful. So I know Dr. Ness just mentioned the whole awareness thing. So when we were talking, he had mentioned something about it's like the ABCs, as you called it, of this, just how to do.
Right.
So A was awareness, the way he said. You got to be aware or kind of create awareness. How does it work?
Yeah, sure. First we defined it, right? And then I think with anything, you try to create a framework so you can have a sense of what to look for, So in the ABCs, as you mentioned, the A really is the awareness. And I think a lot of times what you get from self-reports or interviews is, feelings of isolation, feelings of irritability, low mood, disruption in the sleep-wake cycle. And it's a lot of times that the individuals that are caring for folks with that are, having their own issues with trauma is that they don't talk to anybody. They don't want to burden anybody else. And so they just internalize this stress and they internalize it. And then again, over time, this adds up. And then it starts interfering with relationships, at home, with friends. And again, you become a little bit more self-isolated. So really the A is just looking at the symptoms in terms of the awareness that it's actually going on and the effect it has on you. In terms of like the B of that is really kind of like the behavior and the belongingness and taking action. And so a big part of that too would be the behaviors to help care for that sleep, of course,
that's big.
Healthy diet, exercise. But I think a big piece too that a lot of individuals miss because they don't have time or they think it's too hard is meditation.
Self-care, all the stuff you mentioned was exactly what we've talked about is your sleep. People don't take time, or moms, if we're going to address moms' issues, that we said sleep, diet, exercise, all those things are things that, people become so busy taking care of somebody else, they don't have time to take care of themselves, the self-care. So
they don't have time for. And I worked with a family last week where we used the Headspace app. So there's apps out there for families, and I thought the Headspace was a great start. The founder of Headspace is a former monk who Andy Puddicombe that developed this app. I think it's phenomenal. You could use it for kids, you could use it for adults. It's very effective, and you can start very small, incrementally build up your stamina for meditation to help kind of, just center and balance yourself. And then the C of the ABCs, connections, communication. And I had mentioned it earlier, but we tend to self-isolate when we're feeling stressed and we don't want to burden anybody else. But that's just the opposite of what you should be doing. You should be reaching out and communicating, whether that's with family, your spouse, a partner, friends, close associates, and just to talk about what's going on and just to get it off your chest. And these feelings are intense enough, and you're experiencing them where it's impacting you on a day-to-day basis. And that's really where you got to connect with professionals to really sort things out, because compassion fatigue or secondary stress can also mimic depression, anxiety, ADHD, and a host of other disorders. So it's important to to talk about it and identify it so it's treated appropriately.
Very true. So that's very the thing. So that's the ABCs, as we just heard, for compassionate or compassion fatigue. So again, it's, I know the way you said it, it's just like a different term, but it actually is becoming very real, very true for a lot of, I won't say just women, but almost anyone, a caregiver.
Especially in COVID.
And
you
these times.
You'll see that with our, our healthcare providers
Right.
who are, the 14, 20, 24-hour shifts.
Right.
Again, our first responders,
Definitely.
our teachers right now who are, not only teaching, but also taking on the social emotional,
Very
aspects
true.
with other students. So people are feeling overwhelmed.
Right.
And so it's good to recognize what's happening. That's that awareness piece. You want to belong and have also boundaries too with folks so you don't become overburdened, and then also communicate what's going on.
So there you have it. Thanks again, Dr. Ness. We just understood what this whole thing is. And if you do think that you might have this thing, or if you're experiencing any of these, issues, definitely reach out to our offices. Dr. Ness is also available for, we had mentioned about a consultation with him. So give us a call, find our information down below. And as always, we'll see you on the next video. Thanks.